Hey everybody, several of you in the last week have asked sincerely, Doc, why is this happening? Why does my low back hurt? I didn't do anything. And I hear that over and over again. I didn't do anything. What happened? I'm gonna try to explain to you one way, that very common way that people are ending up with low back pain and they don't realize it. We're trained to explain things to patients in a way that's, in quotes, dumbing it down, and I can't stand that. On the other hand, if we get too detailed, it can get very confusing, right? So what I'm gonna try to do is just explain this to you somewhere in between. I'm not gonna dumb it down, I'm gonna use maybe some big words, but if you have any questions about it, just come to me individually. I think it's important to get the mystery out of why this pain is occurring. My name is Nick Manteris. I'm the treating doctor at Broomfield Spine Injury. And so here we go. Everybody who's asked me this is working currently from home. Their work setup, chair, desk, keyboard, is different than it was at work. So that means that their posture is being forced to be different for an extended amount of time, all right? And everybody talks about, I gotta have good posture, or my posture needs to improve. Posture is mostly subconscious, right? Once we start thinking about something else, body is going to go where it's already been pre-programmed to be. All right, here comes the technical part, and I apologize, but these are just some simple models, right? This is a low back, two bones in the low back with a disc and the nerves that come out. What this doesn't show is the ligaments that hold this all together and the small muscles that support that structure. Okay, so what happens is these small muscles have sensors in them, they have receptors in them that tell the brain constantly how long the muscle is and if it's moving or not, okay? The second thing is these ligaments have sensors that tell the brain where the joint is in space, where is it in relation to the rest of the room and the rest of the body. And the joints talk to the muscles, all right? And the muscles talk to the joints. So they're all neurological organs at some level. It's not just baling wire that holds the spine together, right? It's not like saran wrap. So the problem is this: when we get into a bad posture, we're sitting at home trying to bang out work, right? If we stay in that posture for a long enough amount of time, the sensors in those small muscles, they get off, right? They start telling the brain, hey, this is how long I am, right? And the brain starts thinking that's appropriate. Well, it might or might not be appropriate in that posture, but once you get up to standing, the length relationship, the length tension relationship on those muscles has changed, and it will not support your spine the way it's supposed to when you're up and moving about, all right? Second thing is these ligaments get stretched, and the sensors in those ligaments, via feedback from the spinal cord and up to the brain, start telling the muscles the wrong thing to do. So the muscles, not only are they stretched and the sensors are off, but the information they're getting from the joints is bad information. It's just simply bad information. So then when we go down to pick our kid up over and over again, and you've got flexion, extension, rotation, and this doesn't have the support it needs, small amounts of damage occur, right? And you don't feel it, right? You don't feel the damage. And it's what we call repetitive subfailure. That's a real thing, repetitive subfailure. So over and over again, more damage happens, you don't feel it. Then one day, right, you sit down to do work at your computer, and after 20 minutes you get up, and all of a sudden, oh, I don't know what's going on with my back. Doc, I didn't do anything. I was just working like I normally do, nothing out of the ordinary. Repetitive subfailure and the ligament damage that occurs with it is the number one cause of chronic pain for my low back patients in this clinic. We're all working at desks, and this is what's happening on a regular basis. The amount of pressure, the amount of force that's put into the lumbar spine, to the low back bones and ligaments, is huge. Like, so just sitting is a trauma. It's traumatic. We were not built to live these types of lives. We were built to be up moving around all day long. So to sit down for 3 hours in a posture that's not ideal, right, is traumatic to the spine, sets us up for repetitive subfailure injuries when we just do normal stuff like doing the dishes, doing the laundry, helping the kids. Then one day we go to pick up a pencil or something ridiculous, and your back goes out. And now we've got a herniated disc. This is so cool, watch this. Boop. So, and then we got real problems, right? Less than 2 to 4% of all low back pain actually comes from a herniated disc, okay? And we can go into some of these other causes later, but this is what's happening with you guys. I hope it wasn't too technical. If you have any questions, call me, email, text me. Let's make sure that you get your home set up appropriate. I cannot tell you how important it is. You're talking about the next 20 years you could be having pain, or you could not. I think that's a big deal. So let's get it together, all right?